Today we are going to perform RBC count. Apparatus required for the practical are improved Neubauer chamber, RBC pipette, diluting fluid. The one here we are using is Ames fluid, cover slip, cotton swab, pricking needle in case of finger prick method, but we will be using EDTA vial blood, watch glass, EDTA vial blood and compound microscope. Now let's get started with the procedure. Pour few drops of RBC diluting fluid in a watch glass. Mix the EDTA vial blood properly. Fill the RBC pipette with blood up to mark 0.5 and take care that there should be no air bubbles in the pipette. Immediately after that, hold at the horizontal position and fill the pipette up to 101 mark just above the bulb. Wipe off any extra solution sticking to the tip of the pipette. The pipette is then kept horizontally between the palm and rolled gently for about a minute to ensure the thorough mixing of blood and the fluid. It will have the dilution of 1:200. A clean cover slip is then placed in the Neubauer chamber so as to cover the ruled areas on both sides. Discard the first few drops of fluid from the RBC pipette. Charging of Neubauer chamber. A small drop of dilution is allowed to form at the tip of the pipette, and this drop is gently brought in contact with the edge of the cover slip at an angle of 45 degrees to the horizontal. The fluid is drawn into the chamber by the capillary action. Both sides of the Neubauer chamber are to be charged. The ideal charged Neubauer chamber is one in which there is no air bubble, and it should not be either undercharged nor overcharged. Here in this picture, above chamber is undercharged with an air bubble in it, whereas the lower chamber is overcharged with the dilution flown to the sides of the chamber as well. After charging the chamber, focus the chamber under the microscope. 5 squares in red colors are the square in which RBC count is done. These are the real-time images of Neubauer chamber after charging. Formula for the calculation of RBC is n into dilution factor upon number of squares counted into depth of Neubauer chamber. The dilution here is 200, number of squares counted is 1/5 and depth of the chamber is 0.1. Hence it comes out to be n into 10,000, where n is the number of RBCs counted in 5 medium squares.